Hi, my name is Michael Kemp, and I'm a general surgery resident at Michigan Medicine.
And I'm Daniel Liesman, a medical student at the University of Michigan.
We first want to thank the Journal of the American College of Surgeons for the opportunity to discuss our paper. This study is a part of a quality improvement effort at our institution in order to improve our surgical telehealth program, also referred to as eClinic in our paper. This study identifies factors that are associated with patient no-show in both a traditional and telehealth surgical clinic setting.
We first developed our patient cohort by reviewing completed visits in both telehealth and traditional clinics. We focused specifically on return or postoperative visits across 6 surgical sections, evaluating over 11,000 completed encounters and over 800 no-shows.
In this study, we created a multivariable logistic regression model that identified several relevant factors. Contrary to what we had thought, we identified that patients following up in eClinic as compared to traditional clinic had a higher likelihood of not showing. Secondly, age was inversely correlated with likelihood of no-show in both settings. There are several possible explanations, including potential differences in patient and generational perceptions regarding telehealth. These findings will require ongoing investigation.
Furthermore, patients' race was independently associated with likelihood of no-show. For example, African Americans had an almost 2.5 increased odds of not showing up for their visit as compared to Caucasian patients. Our study therefore highlights that racial disparities exist and may not necessarily be alleviated through utilization of telehealth.
Lastly, we also found that a patient's marital status was independently associated with likelihood of no-show. For example, as compared to patients who are single, married patients were less likely to no-show for their visits, while legally separated patients had a 2-fold increased likelihood. This suggests that factors such as social support can play a role in one's ability to complete their visit in both settings. We also examined no-show patterns across our state by county for each clinic setting. On these 2 maps, our institution's location is designated by the star. These maps demonstrate broad similarities in no-show rates by county, suggesting that geographic location does not play a significant role. Future studies examining county-specific data, such as socioeconomic and demographic data, may elucidate explanations for these findings.
Our paper highlights several important factors that contribute to one's ability to complete follow-up in traditional or telehealth surgical clinics. We want to stress that this data should not be used to preclude certain patients from following up in telehealth settings, as this would lead to systemic barriers that further reduce access to care, especially for marginalized communities.
Instead, we hope other institutions that are pursuing telehealth as a means to provide care and increase access for patients will use this information to identify patients that require additional support. Thank you very much for your time.